Hello, good evening. We are all welcome to today's webinar. Please, can you hear me? If you can hear me, please, can you wave your hand or something? I guess our speaker is already here.
Yeah, we can
Oh,
hear you. Good
okay.
evening.
Okay. Thank you all for joining in. I'm just going to give a brief background to the company organizing it. So KenEi Health is a telemedicine company that is our main aim is to make quality healthcare accessible to everyone, to the underserved, wherever that anyone is, that they can be able to. Our aim is to make healthcare accessible, that regardless of where anyone is, the person can get the medical help that they deserve. So before the end of the webinar, I'm still going to come up to say one or two, but then we're all welcome. I'm just going to hand over the mic to our doctor. So Dr. Emmanuel Norman, you're welcome. Please, the floor is yours, sir.
Okay, thank you, Deborah, right?
Yes, sir.
Oh, thank you so much for having me once again. And good evening to everyone that is here. So, today is International Women's Day. So, happy International Women's Day to all the women here. And also for the guys that are here. So, you can extend the greetings to all the women in your life. So, women are very important in our society and we must acknowledge that. So I would like to share my screen so that um, um, okay, so today's talk won't be much. So I believe, can we all see my screen? Can you hear me? Can you see my screen? Okay, so once again, thank you for having me here. My name is Dr. Nome Emmanuel. So today we'll be discussing about cervical cancer, and of course, is very important to us. And during the course of this webinar, I will be a little bit fast, but I will try to ensure that I pass the necessary knowledge. Now, of course, we just finished the month of February, and usually in the month of February, on the 14th day of the month of February, there is a celebration that usually go on, which is tagged the Valentine Day. And if we all agree with me, is of course some persons say it's a season of love. Is also a time that people engage in a lot of sexual activities as well. So as we go on, we understand that some of the things that went on the 14th of February 2025 have actually predisposed a lot of persons to having cervical cancer in their lifetime. So during the course of this webinar, I will help us to have a very good understanding of what cervical cancer is all about, then the importance of telemedicine, which is where KenEi Health is standing, and how do we prevent ourselves from having this cervical cancer. Of course, in my audience today, I have both males and females. Now, this information it's not just restricted to the females alone, of course. The men here is either you're married or you have sisters or you have mothers or you're going to have your own daughters in future if you don't have them already now. So this information can go a long way to help you. So now we understand that cervical cancer is the second most common cancer amongst Nigerian women. amongst Nigerian women, it means it's killing a lot. So the first is actually breast cancer, and the second is cervical cancer. And in 2022, about 7,000 people were recorded dead. This is excluding those that died in the villages, and people could not attribute their death to anything. Now, what is this cervical cancer? Now, the female reproductive tract, for I believe all of us did biology. For female reproductive tract, we have the uterus, which is the womb of the woman. Then we have the vagina of the woman. So in between that uterus, which is where the baby stays, in between that uterus and the vagina, there is a part that cut across these two parts, and that part is known as the cervix. The cervix. So this part of a woman can actually be infected by a virus known as human papilloma virus. In a short, you can call it HPV virus. So this virus can actually infect that part of a woman's body and cause a lot of havoc. It doesn't only affect that part, it can as well affect the mouth, it can affect the anus of both male and female. But of course, the commonest one that is killing a lot of our women is the one that affects that cervical area of the female reproductive tract. So that's what we'll be looking at today, which I've said is known as what? HPV. Now, what are the risk factors? Like, how do people come in contact with this HPV? Now, if you if you are healthy, most times when women come in contact with this HPV virus, their body will take care of it. Now, but there are things that when you engage in them, you predispose yourself. That's you put yourself at high risk. One of it is for women that smoke, women that engage in smoking. So it means that whenever they come in contact with this virus, the tendency that their body cannot handle the virus is very high. Now, the second one is increasing number of sexual partners. Now, of course, this brings us back to what I said earlier. On the 14th of February, a lot of persons had a lot of sex, or which some people could say they enjoyed themselves during that period. Now, when a woman engages herself in having multiple sexual partners, now that woman is at risk of what? Having contacting human papilloma virus, and that human papilloma virus can go a long way to infect the cervix of that woman and causing this cervical cancer. Now, another risk factor is for women that start sexual activity at a very early age. Now, some persons from the age of 11, 12, they've already started having sexual activity. So, people that start sexual activity quite early, of course, what it means is that by the time, if somebody starts sexual activity by age 12, by the time the person is reaching 20, you can, person must have had sex a number of times. So this predisposes the person to having cervical cancer. And then for people that have other sexually transmitted infections like HIV, like hepatitis, like gonorrhea, syphilis, and the rest of them. So invariably, it means that the major culprit here is sexual intercourse, and of course, unprotected sexual intercourse. Now, this virus, who are they getting it from? Of course, they're getting it from the guys. You get. So now, of course, we will see during the course of this, I will see where the guys also comes in. Now, one of the ways we can prevent ourselves from having this cervical cancer, which is whenever we talk about cancer, prevention is usually key. Prevention is usually key. Now, of course, um, science have made it very easy for us that amongst other preventable diseases that you can take vaccine for, things like you can take vaccine for hepatitis, you can take vaccine for tuberculosis, You can take vaccine for measles, polio, and the rest of it. Now, there is a vaccine for human papilloma virus. There is a vaccine for it. Now, which if you're a woman, what can you do for yourself? You can ask your doctor, am I eligible for this vaccine? How do I get this vaccine? Which is where telemedicine comes in, which is where KenEi Health now comes in. You don't need to go to the hospital. You could just reach out to KenEi Health, and um, of course, a doctor will be connected to you and you could ask all your questions and you'll be properly guided. Now, I will also show us how to get these vaccines as well. Then, other things that can be done is routine pap smear. Is encouraged that once you've reached the age of 21, some people will say once you've reached the age of 25, is advocated that every 3 years or every five years, you should conduct what is known as pap smear. Pap smear is done in the hospital. So most hospitals can do that. It's just for them to, you know, microscopically and visually take a look at the service, take a look at that part of the body and see if something is going wrong there. If something is going wrong there, it could be detected at a very early stage and appropriate treatment can be given to it. Now, what else can we do to prevent this? Practice safe sex. Now, if you cannot abstain, make sure you practice safe sex. And what is safe sex? Ensure you are strict to one partner. You admit to one partner. Now, you can be faithful to your partner and your partner is not faithful to you. It also means that you are engaging in multiple sexual partners. Okay? So you must ensure that whoever you are being faithful to is also faithful to you. If one party defaults, it means both parties have defaulted in this. Now, if a woman and you engage in smoking, all kinds of smoking, cigarette, marijuana, anything that is smoking, it predisposes you as a woman. So it must be avoided if you must avoid this cervical cancer. Now, we talked about the vaccine, which is very key in preventing this cancer of the cervix. Now, there are three different kinds of vaccine. We have the Severus, the Gardasil 4, and the Gardasil 9. Of course, most it's a kind of we started with the Severus. Now we are some hospitals are using the Gardasil 9. Now, these are very expensive vaccines, but in our Nigerian setting now, these vaccines can be gotten for free. Very expensive in the sense that one dose of this vaccine costs a hundred and thousands, like hundreds of thousands. But the federal government of Nigeria has actually made it free, especially for women that are between the ages of 9 to the ages of 12. They will be given two shots 6 months apart. So once they take the first shot, in 6 months' time, they will take the second shot. What it means is that that um that lady or that teenager within this age bracket has vaccinated herself against human papilloma virus. Now, what of people that have gone beyond the age of 16? Yes, you can still take it, even when you have uh, gone beyond the age of 16, even down to the age of 45, you can still take this vaccine. But however, this vaccine works better for girls that are between the ages of 9 to 15. But then, if you have passed this age, you can as well still take the vaccine. But instead of taking two shots, you're going to have three shots. So the first one will be given on the first day you arrive at the hospital, and they have screened you and they have confirmed that actually you do not have this virus already. Because if you have the virus already, because some persons will have it and they do not know until they are screened and it is discovered. Now, once you are screened and it is discovered that you do not have this virus already, they will give you the first shot that day. After 1 month, they give you another shot. And in 6 months' time, you will take the last shot. So that way, you've been what? you have been vaccinated against human papilloma virus. Now, what are the screening that is expected of us, especially as a woman? Now, someone might ask, can since this virus can as well be found in male, in fact, sometimes this virus can cause penile cancer in a man. So, since this virus can also be found in a man, can men take this vaccine? Yes, in some countries, men can take the vaccine, but in our country, Nigeria, government is only paying for women. So, if as a man you decide to take this vaccine, most likely you're going to have to pay for it. But men can actually take the vaccine. Now, for the screening, how do I screen myself? Probably I've not been vaccinated. How do I check if I have this virus or not? Once you reach the age of 25 to 29, it's expected that you should do what is known as what? Pap smear. Pap smear. And where do you do pap smear? It's in the hospital. And how do you know if you need pap smear? It's by calling and reaching out to a doctor. And how do you reach out to a doctor? That is where telemedicine comes in. You don't need to go to hospital and be in a long queue to get an advice from a doctor. So once you reach the age of 25, it's expected that you should have had your first pap smear. You should have had your first pap smear. It's not a difficult procedure. Once you go to the hospital, in 10, 20, 30 minutes, they're already done. Now, for people that have already reached the age of 30 to the age of 65, they can go ahead and do both HPV test and also um, pap smear test. It's expected that they do this every 5 years, every 5 years, because at this stage of their life, they are already what sexually active. Now, for older women, especially if you have mothers that are already very old, they've reached the age of 65, you might be asking, what can they do? Can they take the vaccine? No. Now, what is expected of them is can they do? Can they take the vaccine? No. Now, what is expected? Talk to a doctor. Talk to a doctor. The doctor will ask some questions and advise them if there is need for them to take the vaccine or not. And once again, this is where telemedicine comes in. And of course, KenEi Health is a formidable telemedicine platform where you could actually go into and you will have a lot of your problems sorted out. And what else can you do with telemedicine like KenEi Health? Is also another platform that you can ask for a second opinion. Like, for example, I want to issues and I want to conduct some laboratory tests, but I don't know which one to actually, there are a lot of laboratory tests to be done. I don't know which one to do. So, which one do I do? I need to talk to a doctor. You can reach out to KenEi Health and they can refer you to a doctor and you talk to the doctor and the doctor will say, okay, do this one, don't do this one. So that way you avoid spending a lot of money on some tests that are unnecessary for your ailment at that time. There is also what we call second opinion. Second opinion is in a situation where you went to a hospital and the hospital said, okay, madam, we are going to carry out a surgery on your eye. And you're not very comfortable with it. You're like, does my eye really need surgery? you know. So, and you needed a second opinion. You needed another doctor to make an input to tell you, okay, yes, you should go for the surgery, or there is something else that could be done about it. Telemedicine can go a long way to help. Or you have a laboratory investigation and you need it to be interpreted and appropriate medicine given to you. Telemedicine is where to run to, and KenEi Health is formidable for that. So I've come to the end of my webinar for today. So if you have any question relating to cervical cancer or things that you've heard, it could be myths, it could be things that people have said in the past, and you need clarification on that. So the floor is open for you to ask your questions. Thank you so much for listening. Okay, so I think your question is in order because some persons might be scared. Of course, this is a very delicate part of a woman's body, and people will be like, ah, what do you want to do inside that place? So it's not a painful test per se, but of course, because of the delicate nature of that place, of course, you're going to have a little discomfort during the time the procedure will be done. So some things to be sprayed and sometimes samples will be taken and analyzed under the microscope, and then some other tests will actually be done on it, and you'll be asked to come on so day to have your result. So it's not a painful test, but you might have one or two discomfort because of course, you know where they are entering. So
Okay. Okay.
Good evening,
good
doctor. Good evening, everyone. So I would like to ask, how many times are we to take the vaccine? I might have missed it during the class, during the lecture. So
okay, so I said it depends on your age. The best time to have the vaccine is between the age of 9 to 15. So if you are still within that age range, or you have someone within that age range that you want to take the vaccine, they are going to take two shots. So the first one they will take on the first day they arrive at the hospital and they confirm that every parameter is okay. Then in 6 months' time, they will take another shot. It means they've been vaccinated. But then if you are beyond age 15, so let's say from 16 years to 45 years, for example, you are going to take three shots. The first one on the day of arrival, if confirmed that all parameters are good, you take the first shot. Then in 1 month time, you take another shot. Then in 6 months, you, from the first day you took the first shot, you take the last shot. That's it, and you are okay. So that's that.
okay, thank you, sir. Another question: are there any physical signs that we know that someone has cervical cancer, just like breast cancer? If you feel lumps, also.
Yes, your question is very important. Of course, there are physical signs, things that could give you a clue that I think I need to go see a doctor, or I think I need to call a doctor. One is if you notice that all of a sudden during sexual intercourse it's becoming very painful, and each time you have sexual intercourse you come down with what is known as postcoital bleeding. Now, each time you have sex, you see that blood actually is coming out from your private part as a woman. And also, you start noticing some very unpleasant odor coming out from that place. It could be a clue that you need to see a doctor. It could be a clue that you are actually developing cancer of the cervix. And also, some people might have unpleasant pain like frequent backache and all that. So once you start noticing some of these features, especially postcoital bleeding, is a pointer that you might need to see a doctor as quickly as possible. So these are some of the few um, um, early signs. Other signs are signs that you will see when it is already full-blown cervical cancer. Probably at that stage, there is when it's already an advanced cancer, there is nothing much that could be done about it. So these are the little things you will pick at the earliest stage of the cancer development. And once you pick it very early, and you come to the hospital very early, it can actually be taken care of. Thank you.
Thank you, sir.
Good evening, Doc. Uh,
Good evening.
Mine, I want to ask a question. You talk concerning HPV, that is human papilloma virus, which is the culprit that is in charge or that lead to cervical cancer. Among all the cancer, is it only cervical cancer that HPV is responsible for, or any other cancer that can also be triggered by this uh, human papilloma virus? Sir?
Okay, nice question. Um, when I was talking, I made mention of the fact that human papilloma virus can actually affect other part of the body. It can affect the mouth, the lips, in fact, the throat. It can cause cancer of the throat. It can cause cancer of the lips. It can, in men, it can as well cause cancer of the penis. Now, in there are reports coming now that in men that have sex with men, they are now coming down with cancer of the anus. And what's the major culprit here? Is still human papilloma virus. Do you get? That's why I also mentioned that during vaccination, in some countries, they're already vaccinating men. They're already vaccinating men in some countries because the women, most times, will get it from the men. So why not vaccinate both the men and the women? Okay. And but of course, the major one that is killing people in Nigeria, for example, is the one that is affecting the service. The one that is affecting the service. So human papillomavirus can go a long way to cause other cancers, cancer of the throat, cancer of the mouth, cancer of the um, vocal cord, cancer of the penis, cancer of the anus as well. So thank you.
KenEi Health is here to solve. So basically, so with KenEi Health, we provide virtual consultation from the comfort of your home. You can consult with a qualified doctor, just like our doctor have stated earlier, that it's not everything that you run to the hospital. First of all, you can consult with the doctor online. You can consult with the doctor using our platform, and they can recommend, say, okay, if this is an issue for you to go to a hospital, or if it is something that they can just recommend a drug for you, and you can just get the medication and all that, and you can move on from there. So this service is basically good for everybody and anybody. So now you don't have to bother about your aged loved one that is in the village, and oh, there is no quality, there's no qualitative medical care around my village and all that. So from the comfort of your home with KenEi Health, you can just install the app for them, and when there is an emergency or when there is any issue that is health related, they can consult a doctor from the comfort of their home, as long as there is an internet and all that. And with that, they can be able to administer drug to them or prescribe drug to them. That is the appropriate word. So you no longer have to go queue, you no longer have to transport and all that. You can access quality healthcare just from the comfort of your home. So that is what we offer. So beyond consulting with doctors, we also offer services of home lab tests. Like, okay, with time, although we have not introduced that, but with time, you can be able to, from the comfort of your home, we take samples from. I will have our medical personnel come to your place, take samples and from of your sick loved one or anybody, then run the test and bring the results down to your doorstep. You don't even have to leave your home. So this is what KenEi Health is delivering. This is what KenEi Health wants to make accessible to us. So we have healthcare that is accessible. You don't have to leave your home. Now that emergency is no longer emergency, because with your phone, whatever that is happening, you can talk to a medical practitioner and you get medical advice on where to go from there. So this is basically what KenEi Health is promising, and this is basically what KenEi Health is making available to us. By the end of this month, KenEi Health will be launching her app, and we hope that each and every one of us here will be subscribed to it, and also speak to your loved ones about it. There's nothing as comforting as knowing that, okay, that your loved one's health is covered. Maybe you're not in the place. There's nothing as comforting as knowing that, oh, even though I'm not where my loved one is, but the person is secured in a way that, okay, I don't have to bother anymore because the person doesn't have access to medical care, but because the person can be able to consult with a doctor, with a qualified medical practitioner online, they can be able to prescribe the appropriate medication the person needs to take. Now you're no longer left at the mercy of quack or at the mercy of unqualified professionals.
Sorry.
Hello, good evening. Good evening, everyone. Please, I joined a few minutes ago. I don't know. I'm trying to understand what everything is all about, but from the little I can get here, it's actually an app where you can subscribe and get medical attention without going to the doctor directly. So I want to know if, let's assume it's something that requires for you to go to hospital to take a test. How do you now get a test done from online? I don't know if you understand them. Hello. Yes, how do you now go through the test, like that requires a test? How do you now go through it so that you'll be sure that this particular thing they are prescribing for you is actually the drugs they are prescribing for you is actually for what is wrong with you? Thank you. Okay, it answers the question, but another one then is, um, are there privileges like benefit to the consultation? Like, are there benefits, more benefits like from the something that differentiates its physical hospitalization, like going to hospital, something that differentiates it? Are there benefits?
Good evening. So I will take more questions after now, but I want to answer your question before I introduce someone. She will talk with us, and then we'll continue answering your questions either on cervical cancer on the platform. But the platform itself is making use of two ways to diagnose medical care for you. The first is we have an inbuilt medical AI that we first of all do Scott work, where it analyzes your symptoms and then takes those your symptoms and recommends a doctor in the specialty to talk with. And then if the doctor talks with you and requires additional tests, you can either book a med lab practitioner to come and provide that medical care for you, or you can go to any medical lab of your choice, do that test, upload the result to the medical doctor, and then he prescribes treatment based off of that result. Those are the two ways. That is the two ways we are ensuring that the quality of medical service you are receiving is up to par. So I will take more questions on the platform and on cervical cancer, but I want to introduce um, a very good friend and someone that have years of experience in the medical profession. So, and she's also the secretary of the Watchman Medical Professional Forum. So I'm introducing and yielding the floor to Nurse Miracle Aloysius to speak with us. You're welcome, man.
Good evening, everyone. I wouldn't take much of our time. I'll dwell on today's meeting. Our My colleague in the field has already laid a very good foundation. That's Dr. Nome. So basically, all being said and done, my focus is what are the ways to prevent cervical cancer? And I'm talking on evidence-based practice because I have lost lots of patients, and early this year I lost a cancer patient, and it was a very tragic one. That's why I'm focusing my teaching, my little 5 minutes talk on prevention. One of the best ways you can prevent cervical cancer is knowledge. What you don't know, you can't conquer. When you get to know your status, and how do you know your status? Pap smear. Last weekend, my organization usually organizes free immunizations for staff. So a colleague of mine, she told me she's going for HPV. She paid, did the pap smear. Some other people were like, what if it comes out positive? What if it comes out negative? What you don't know, you can't conquer. What you don't know, you can't take care of. So as a lady who has gotten up to the age of 25, 30, 35, 40, even if it's once a year, you go for pap smear. Check, what's my cervix status? Am I good? Okay, down there. And the other thing too that I would hinge on is contraceptive, especially for married people who are sexually active. Contraceptive, not, I don't really buy into the idea of using steroids as contraceptive. For your family planning, I would advise, see, taking care of your body will cost you money. There is no easy way around it. Yes. There is no easy way around it. For you to take proper care of yourself, you have to be ready to spend on yourself. And spending on yourself entails going for appropriate medical counseling on, you know your body, your doctor knows your body better. He knows the type of family planning you need. Are you understanding me? I'm not going to go into family planning methods now because it's going to take a lot of our time. But one thing that poses a huge risk for women to have cervical cancer is oral contraceptive, consuming lots of steroid. And you know the bad thing about it? In Igbo, ndị Igbo tụrụ ilu sị, ọnwụ ga-egbu nkịta ga-ekwe ya n'oshinshi. That means when a dog is about to die, death will not allow him hear the smell of a poo-poo. See, steroids, what they do is, as you are eating, as you are taking in the steroids, is making your body glow. They're looking at you, oh, you're looking ever young, you are glowing. That's a side effect of steroids. They make you glow naturally. You look more beautiful. Your skin is glassy. It's a side effect. It's one of the thing that comes out of it. But what about what it's doing to your body systems? So I don't really buy into daily. Once in a while it can be there, yes. Once in a while it can be there. But every day taking in oral contraceptives poses a huge risk for you as a married person for cervical cancer. So I will advise you, my 2 points on this is, as a woman, we still have 9 more months for 2025. Pap smear, I think my colleague said she just did it for 11,500. You can save out a huge chunk of your money and go do pap smear. It's just once a year procedure and it doesn't pain. It's not a harmful procedure. It's just to check your cervix status. Am I at risk for this or am I fine? You see, from now to December, you can plan out any of your salary. Go check and know your status. When you check your status and it's there, start early treatments. Yes, people say that cancer patients don't survive, but I've seen cancer patients survive in my organization. People who keep up strictly with their chemotherapy. They come and you see them getting better by the day, getting very better by the day. And before you know it, in 6 months, 3 months, 4 months, some of them are better than they used to be. People survive cancer if there is early dictation. So if you go for pap smear and there is it's dictated, start your early treatment. If you go for pap smear and you are fine, you register like Dr. Nome say, go for your HPV vaccination. And then if you are married here, go see a doctor. Okay? Spend the money. 20,000, 10,000, depending. Stop relying on, I'm a nurse, but I'm going to tell you, stop relying on roadside chemist people that open. They will tell you, oh, if you after meeting your husband, drink small stout, it doesn't work that way. Are you understanding? Go meet a medical doctor or someone who is in that field. I want to do family planning. I want to know the right one for me. They will guide you aright. They are there to guide you aright so that you don't fall into trouble. So this is what I have to say to you. On this day of International Women's Day, the best gift I'm giving to you is please, before the end of this year, try and do a pap smear. Thank you very much. And with this, I end my talk. Thank you. Thank you, Gideon, for the opportunity.
Thank you very much, ma'am. Um, okay, you wanted to say something, sir?
Thank you, Nurse Miracle. Over to you, Deborah. You can continue with the question and answer. Miracle is here to answer. Dr. Nome is also here to answer.
Okay. Please. Okay, Grace. I don't know. So, are you clear, or you still need some more clarification? Hello. Okay. Yeah, she just dropped the chat. Okay. Do we have any other question? Okay. And Doctor, sir, you have the floor, sir.
Okay, just to also say that, of course, there are so many wrong, some persons can say myths or things that are wrong that are in the mind of people as regards the cervical cancer vaccine per se or the HPV vaccine, because there is a lot of hesitance. People are not really buying into the idea of taking their children or permitting their daughters to go for the vaccine. Some say there is a way of getting them sterile, is a way of making them not to be able to conceive again. Some say if I take the vaccine, I will have a lot of side effects. Like a lot of things are being said concerning the vaccine. But the truth is, all the people saying all these things is either they've not taken the vaccine, they've never even seen anybody that have taken the vaccine. So all these things are speculations. Now, I've seen people that have taken the vaccine. The only side effect or per se side effect you might have is the pain of the injection. Of course, if they put needle into your body, it's going to pain you. The pain of the injection, and in some persons they might have dizziness, which might not last for more than 24 hours, and you're fine. And then some persons can have headache, which might not last for more than 24 hours, or you might take paracetamol and you're fine. And then you've provided yourself with something that can do you good for a lifetime. And like Nurse Miracle said, pap smear is very important. In fact, most hospitals for if you are in the northern part of Nigeria, most government hospitals in the northern part of Nigeria, we do pap smear for you for free. For free. And then that brings me also to the telemedicine that we're talking about, which is where KenEi Health comes in. In order to actually clear some doubt, of course, someone can have an illness and it's an emergency. It's an emergency. The next question you ask yourself is, this emergency I'm having now, where exactly am I located? Assuming you are in your village and there is an emergency going on, and then there is no hospital nearby. Do you take yourself to a native doctor, or do you take your child to a native doctor? You have to consult a, because at that point your hands are tied. Now, instead of doing the wrong thing, it's better you consult a doctor. Explain your symptoms, and then the doctor might tell you, okay, do this, do that. Sometimes the what you need to do to keep the person alive at that point might not really be medicine. It could be someone that just had a heart attack and you just need to give the person CPR before getting to the hospital. If not, by the time you reach the hospital, the person is gone. So sometimes this is where also telemedicine now comes in. And sometimes people believe that I need to go to the lab first for me to know what is wrong with me. But the truth is that you need to see a doctor first before you go to the lab. If not, there are so many tests that can actually be done in the lab, so many of them. Now, what directs whether you will do this test or do that test? If you don't have a doctor directing, okay, do malaria test, do urine test, do blood test, do this one, do this one. By the time you get to the lab, of course, they're going to do a whole lot of tests for you, both the ones that are important and the ones that are not important for you. And you're going to spend a whole lot of money than when you consult a doctor. By the time you list your symptoms, he might say, okay, do this test, leave this one, do this one. And like Gideon said, by the time you are done with this test, you can actually reach out to the doctor back, and then he will have your result analyzed and appropriate medications provided for you. And then by the time you talk to the doctor, and from your symptoms, he feels is something that needs you to be seen physically, he can say, okay, go to. It's also important for you to know, because your condition can be a case that will require a specialist to attend to you. Assuming you are having a case that requires you to see a neurologist, maybe you have someone that is having epilepsy and you've taken all the medications and it's not stopping. You need to see a neurologist. Now, who decides whether you see a is a doctor, and who decides how you will get to see a very good neurologist is also by you making use of this platform, making use of this opportunity. So you see that um, telemedicine is a very good platform that we can actually use to our own benefit. So I implore every one of us to buy into the idea, download the app, make your subscriptions, and then follow up with the promptings that will be coming up from it. And then um, I know that, yeah, it's not something you will regret. So that's on that. Thank you so much.
Okay, thank you, Doc. My question is there a way to verify the authenticity of the doctors that will be having on the app? Like, is there a way I'll be sure that okay, person I'm talking to is actually a doctor for this or doctor for that? I don't know if you get my question.
Yeah, I think this question should be for the CEO of KenEi Health.
Yeah.
So,
So I want to answer. So the way we verify our doctor, so we are partnering with two companies that helps us in verification. One of them is Apoke. The other one is Simplex. Simplex is the verification company that MTN uses for your NIN verification. So for doctors or nurses, once they come on board, they are required to provide the number attached to their medical license, of which is already in the Nigerian database, and upload certain documents. Those documents are cross-checked with the NIN information, cross-checked with the pictures they take to make sure that the person is who he or she says he or she is. The verification process takes 24 hours between these two different platforms to authenticate the university the person went to, the status of the medical license, and to know whether there are any police case or any malpractice case filed against the doctor or the nurse or the hospital in questions. And we have an AI working. So the AI doesn't just stop when you want to talk to doctors. As you are having a conversation, a chat, or voice call with the doctor, it is also analyzing the quality of the medical information you are receiving to make sure that the quality is up to the standard. So, and we also have a button, we also have a way where we investigate any allegation of poor medical advice or quality. So we have taken so much steps in compliance with the Nigerian Medical Association to make sure that all the doctors on boarded are certified and all the medical practitioners are certified to give you guys the right medical care you need.
Okay, sir. Okay, sir. I understand that.
This brings us to the end of today's webinar. Okay, someone is asking for the link again. Okay, let me just copy and repaste. Okay, I just reposted the waitlist link. So please, and also follow us on all our social media platforms. We send out informations there. By the end of this month, we'll be launching our app officially. So please do follow all our social media platforms. It will help you be up to date in whatsoever that it is that we are doing. I guarantee you that you've never had a medical care this easy before. You've never had it so accessible and at your fingertips. So please take advantage of this. Take advantage of this wait list. Take advantage of the fact that we are the subscription. Okay. Someone is okay. The platform name. Just search KenEi Health. On any platform, search for KenEi Health. Be it Twitter, Instagram, LinkedIn, all the social media platform. Just search. You're going to see us. We have presence in all the social media platform. And also, if you got the mail, at the bottom of the mail that we sent out this evening, you'll see our social media links. If once you click on the Facebook, it will take you directly to our social media and to our Facebook page. Or if it is WhatsApp, it will take you to our WhatsApp community. If you click on the Twitter, it will also take you to our Twitter page. So please, if you are among those that got the message, if you got the message, if you registered for the webinar, and you're among those that got the link, so do well at the end of the message. In case if you don't see it on your mail, check your spam. It might be there. At the end of the mail, you will see our social media our social media links there. Click on the Facebook, it will direct you there. So this brings us to the end of this webinar. This webinar was recorded, and don't worry, everything that we did here, you can still have it, you can still rewatch it, you can still go ahead and rewatch it just in case you missed any information. So thank you all for joining. Once again, if you are yet to join our waitlist, please do well to join the waitlist. It's for your benefit. And also, you could recommend a family member to also join the waitlist. You could also, because when we launch, we'll be having family plan and individual. So please do well to join our waitlist. Thank you and good night.